Thanks.
Director and Elke, can you guys hear me okay?
Yes.
Okay.
Hi, everyone. This is Misty again. I've got Nikki Forbing-Orr on my line. We're still trying to get it figured out. So if you can give me one more moment, I'd appreciate it.
Elke, just so you know, you're off mute.
Director, do you think we should just, this is Chris, sorry, do you think we should just start? I think we know what we want to say. I don't know. I hate to keep all these folks waiting.
Hi, everyone. This is Misty. Nikki is continuing to have some issues, so she's asked me to go ahead and thank you all for joining this media briefing about COVID-19 vaccine in Idaho. Again, I'm speaking for Nikki Forbing-Orr, and she will be the moderating today's briefing. Before we get started today, I wanted to let you all know that we are now able to provide ASL interpreters for these briefings. You can hover over the 3 dots to the right of their video window to lock their screen in place. Click on the layout option in the upper right corner, then click on full screen. When the full screen appears, a floating window of the panelist will show. Find the video labeled ASL interpreter. You can increase the video size by clicking and expanding their video. We'll be hearing from the Health and Welfare Director, Dave Jepson, Public Health Administrator, Elke Shaw-Tulloch, and Dr. Christine Hahn before we open it up for vaccine-related questions from media participants. Yes.
Okay, Misty. Oh, go ahead, Misty.
We will be taking questions from the public at this time. Please note that everyone should be muted unless they're speaking. And with that, I'm going to turn it over to Director Jepson.
Thank you, Misty. Sorry that I interrupted you there. Welcome, everyone. We apologize for our technical challenges. I'm sure that's not the first time that's happened to you on a WebEx or Zoom call in the last year. Again, I want to say we're committed to transparency, to communicating, to sharing what data we have, and these calls are part of that overall plan to do that. This last week, many thousands of first responders, pre-K through 12 teachers and staff, daycare staff, and correctional and detention facility staff received their first doses, and many healthcare workers received their second doses. We've had 96,896 doses administered to date, and 81,210 people have received vaccine. At the end of last week, Idaho had received 181,100 doses. Let me say that again, 181,100 doses, and administered 51% of those doses, compared to a national average of 53%. Last week, we saw a record number of doses administered at 25,504. My personal thanks to those providers who are doing a great job administering the vaccine to those who want it. I want to talk about February 1st for just a minute, which is when those 65 and older become eligible for the vaccine. There are roughly 269,000 people in Idaho who are 65 and older, but we only receive about 21,000 doses a week. That means most of that group will not be vaccinated on February 1st or even the first week. We ask for your patience, as everyone 65 and older who wants the vaccine will be able to do so, but those appointments will happen over the coming multiple weeks. The last several weeks, we've been discussing the use of a tool on our website called PrepMod to help people get connected to local vaccine clinics. As we have explored the functionality of PrepMod for this use, we have found it to be redundant with what is happening locally with each public health district. So instead of using this tool and creating two solutions, we are instead going to enhance our state websites to clearly explain who is eligible for vaccines and connect the people to the local public health districts' websites and call centers. And that is where individuals can find and make appointments with vaccine clinics in their area. So that'll happen at the public health district level. Again, we'll have a statewide website update, a page on the coronavirus.idaho.gov that will make that connection clear. PrepMod remains an important scheduling and management tool for many providers across the state, and those providers will continue to use it. I also wanted to say a word about the governor's emergency declaration. Our ability to effectively distribute vaccine would be disrupted without the emergency declaration. We would lose access to the current hundreds of National Guardsmen who have become so critical to our vaccine administration plan. Access to specific federal funding through FEMA would no longer be available. And the strong partnership we have developed with federal partners, such as the Boise VA Hospital, would end up affecting both vaccine distribution and testing. To provide a specific example, the Idaho Office of Emergency Management and the Department of Health and Welfare are in the process of requesting an incident management team from FEMA to assist with vaccinations in Idaho. This incident management team will support the public health districts, and they are finalizing up the exact mission. This request cannot be made without an emergency declaration. Finally, I wanted to emphasize once again how important it is that we all continue to follow those basic safety protocols. Wear a mask, maintain 6 feet between non-household members, and wash your hands frequently. Avoid large gatherings as much as possible. It's still critical that we follow those measures as we move through the vaccination process. And with that, I will hand it off to Elke Shatolik, Division Administrator for Public Health.
Thank you, Director. And as the director said, I'm going to be going over a couple of items with you, and then my apologies, but I do have another commitment, so I will be needing to leave as soon as I'm done giving my remarks, and then I will turn it over to others. So as the director stated, we will be opening up vaccines to people aged 65 and older on Monday, February 1st, and we are very pleased to see that our capacity to administer vaccines continues to improve, particularly as we prepare for the roughly 260,000 Idahoans aged 65 years of age and older that aren't living in long-term care facilities, who will be eligible for vaccine on Monday. Since Idaho is receiving just under 2,100 doses each week, we will not be able to vaccinate everyone over the age of 65 and older who wants a vaccine all at once, but it will take multiple weeks, as the director pointed out, to be able to do this. We're hopeful that we'll see an increase in vaccine available to us by late February or March. So if any additional types of vaccines are authorized, it will allow us the opportunity to vaccinate more people at one time. We ask for your patience as appointments are being scheduled across the state. People in this age group can look to their local public health district for information on where to find and set up appointments to get vaccinated. We also ask on behalf of our healthcare partners providing vaccines that when you do have an appointment, regardless of what grouping you're in, please keep that appointment, or if you have to cancel it, please let your provider know as much in advance as possible so they can fill that appointment with someone else and not book an appointment with, and also please don't book multiple appointments with multiple providers. This will help ensure that we get people vaccinated as quickly as possible and prevent the wastage of vaccine. I also wanted to talk to you today about the results from our COVID-19 Vaccine Advisory Committee. The COVID Vaccine Advisory Committee, we call it CVAC, provides recommendations to the department and the governor on prioritization of populations to vaccinate when vaccine is in limited supply. And CVAC met last Friday to review the results of the votes that they took online and to vote on additional input to vaccine priority groups 1 and 2. These votes were recommended to the governor, and he approved all votes, but included a request for CVAC members to consider frontline utility workers, particularly those who work indoors and provide a critical role for our communities, to have dependable water, power, and gas to be considered in Group 2 in our subset 2.3. There is one exception. Since Friday, the department determined that more committee discussion was needed on the in-home provider population that we reviewed. After further review of the definition of in-home providers and the data regarding the large population size of this group, the department is going to be asking our CVAC members to review this population of nearly 290,000 individuals potentially at their next meeting to potentially redefine the definition or create subsets for prioritization. So in summary, the results of our CVAC work that we did and in working with the governor's office, the updated Group 1 is now clarified to include clergy who enter healthcare facilities to provide religious support to patients, as well as behavioral health workers, including counselors for substance abuse treatment centers and suicide prevention hotline workers. For Group 2, clarifications included adding mortuary and funeral service personnel, along with coroners and medical examiners, as well as adding the approximately 4,600 homeless shelter residents into Group 2. So that includes my prepared remarks. Dr. Christine Hahn is following me. She has some prepared remarks for you all. And as I mentioned, I do have another obligation and I will be leaving the press briefing, but Director Jepson, Dr. Hahn, and Sarah Leeds, our immunization program manager, will be here to address your questions. With that, I wish you a great rest of your briefing.
Thank you, Elke. Director, can you confirm that you're able to hear me again? When I unmute, I always like to check.
I can hear you just fine, Dr. Hahn.
Oh, thank you. Yeah, so thank you everybody for being here today. I have 3 points I wanted to cover before we get into the question part of the meeting. One is just to talk about the goals of the vaccine effort in Idaho, which seem self-evident, but I just want to remind everyone that we have more than one goal. Other vaccines coming along, as Elke alluded to, which might be game changers for us. We're really hopeful. And then thirdly, just kind of where we're at now, and then what we think the new variant strains might do to that situation. So I'll start with the goals. In my mind, at least, we have 3 goals, and would love it if they always work together, but sometimes they can seem competing. And those are speed, of course. This is what we're most commonly measured on. That's what you can look and see numbers, how many vaccines have been administered, and compare that to other parts of the country. That's trackable, comparable. Of course, it's important. We want to be getting this rolled out as quickly as possible. We realize that we want to get ahead of any variants that come into the state. We want to get people back to normal as quickly as possible. And that's something that we are definitely working very hard on and very focused on. But I want to remind everybody of the other 2 areas that we're just very mindful of. The second is safety. And again, early on, especially in this effort, some other states really stumbled, had some mistakes were made, and wrong products were administered, that kind of thing. This is super critical for us. Many of our vaccinators that are now administering COVID vaccines are not vaccine providers that we normally work with. We usually work with pediatricians and family medicine doctors and pharmacists and others who vaccinate children. Our program has always focused on children. Providers that vaccinate adults, for example, flu shots, whatever, they just order those on their own. We don't usually have a working relationship with them. So this is a new territory for us to be working with a lot of these providers. We've talked a lot about enrolling more providers, and we continue to do that. But really, we need to make sure these new providers are new to us, and they are working with a new vaccine or new vaccines, have the proper equipment, the freezers, and have had the training. Their staff have had the training. And even though we feel as pressed as anyone to get this out as quickly as possible, we absolutely can't sacrifice safety. Not only is that wrong for the patients, but it also could really erode trust in the vaccine if we had safety incidents where mistakes were made that jeopardized their safety. So that is super important. It's harder to measure. We have the absence of events, but that's not as easy to track as, for example, number of vaccines administered. The third area, and I think this is the hardest for us to measure, is equity. We're focused now, we talk about health equity a lot in public health, and yet it's obviously hard to measure in a lot of ways, especially right now we're pushing out new programs. We haven't had time to build in ways of tracking some of that. But we have 2 things that we are focused on right now that we're really mindful of. One is geographic equity. So as many of you have heard Sarah Leeds say, in other meetings, is that she works very hard with her program to look at the number of vaccines coming in every week and then divide it up as fairly as possible to the local public health districts based on the population, the providers that they have, how much vaccines being ordered. We're very mindful that those local health districts, then the burden sort of transferred to them to make sure that their communities are fairly getting access to the vaccine so that small rural communities aren't left behind. One way I've been looking at this, although I think it's early to draw a lot of conclusions, is looking at just vaccine rates per county. Our vaccine dashboard now you can see how many doses have been administered per county. And if you look at a population level, it's interesting to me that some of the counties that per population have the highest rates right now are actually some of our small rural counties. They have smaller populations to manage, and in some ways that's been easier for them. And yet we want to maintain equity. And so the other thing that's been a little challenging in the beginning is that counties that have long-term care facilities and large hospitals are going to potentially have more employees of those healthcare workers, and they're going to seem like they're getting more doses, and they are getting more doses early on because of the way that the vaccine is targeted. But we are going to keep watching that and just ensuring that the vaccine is getting out to small communities. I just heard this morning from Health District 4 that they are working on some clinics this weekend in 2 very small communities, and that just made me really happy to know those efforts are going on. So the other The other thing we have, other than us trying to watch for geographic equity, is we have our vaccine advisory committee that I know most of you are very familiar with. Our advisory committee has met regularly since October, and we have really leaned on them to help us make those tough calls of, is it, should seniors be next in line? Should people who work in healthcare facilities, people who live in long-term care? None of those are easy decisions. We would all love to see all those folks get vaccinated as quickly as possible. But because of the constrained supply that you've heard about from the director and from Elke, and you're well aware of, we had to make these decisions. And our advisory committee, which is very broad-based, I'm sure many of you already gone on the website and looked, it's the largest committee that I recall ever the health and welfare having, with, we will have 100 people on the call. We'll often have 30 plus people voting of our voting members. It's a large group, but we wanted to have a big tent. We wanted to have a buy-in and have people feel like they had a voice. We have medical providers on that. We have ethicists. We have people who work with certain populations, Hispanic population, people who work with people with disabilities. So we're trying very hard to ensure equity by working through our advisory committee. And then just lastly, as far as the goals of the program, I just want to mention a side note is that we're very pleased that so far we have had very few doses that have had to be thrown away because they couldn't find someone to vaccinate, or because there was some sort of error in its handling and it had to be thrown away. Sarah Leeds has mentioned that right now we've had 26 doses in the state. We'd rather it be 0. And we encourage providers that if they absolutely can't find anybody in a priority group, we would rather see someone get vaccinated than see that dose thrown away. But every once in a while it has happened, but we are really happy to see how rarely it is happening, and that most providers have really nice strategies in place to try to ensure doses don't get thrown away, including having people they can call in a pinch that can show up for a vaccine if they have extra doses. So we're working really hard to continue to minimize waste of that vaccine. So the second thing I want to talk about, and a little more briefly, our other vaccines coming along. Elke already mentioned that we're hopeful. The next vaccine that may arrive is by Janssen Pharmaceuticals, which is owned by Johnson & Johnson. This vaccine, it would have 1 dose, so it'd be a lot easier. It also doesn't require the freezers that we've had to deal with the first 2 vaccines. It's simply refrigerated, so logistically it'd be much easier. 1 dose will be a lot easier. So we're very hopeful. This is hopefully going to be getting emergency use authorization in February if the current clinical trials that are still ongoing show that it has good clinical efficacy of that vaccine. So if we get that, the estimates, you heard Elke and the director saying it's going to take a long time to get all, weeks to get all our seniors vaccinated. We know we'd much rather have them vaccinated more quickly. But if we have a new vaccine out there, especially one that only takes 1 dose, everything's going to speed up. So we're very hopeful, but of course, waiting for FDA to review, waiting for the CDC's advisory committee to review and ensure that it's safe, that it's efficacious, and who it can be used for. So we're very hopeful for that. And then thirdly, I just want to mention that, we are very happy to see, if you look on our state dashboard right now, you'll see that our hospitalization rate right now is only about half of what it was in early December. We're so thankful for that. We feared for the worst on that. We saw our numbers going up, and we really worried that we would not be where we are now. So we are really pleased. I think the Idahoans have stepped up. I personally notice more people wearing masks more routinely. I think that we are doing better in a lot of ways, but we can't take it for granted. And one of the things that's looming is the threat of these new variant viruses that might be much more contagious. They appear to be more, as we've seen the data from lab studies, we've seen the data from the United Kingdom for that B11K strain, suggesting that it is more transmissible. And even though so far the news has been very promising that the current vaccines will cover the strains that are being seen out there, there's a little concern. You may have heard just yesterday, Moderna is looking to develop a possible booster dose should one of the new strains out there not be as susceptible to the current vaccine. So this is just going to be an ongoing struggle. And one more reason why we want to get folks vaccinated as quickly as possible, just to tamp this virus down, to keep it from being able to mutate and potentially be not impacted by vaccines. So we are watching for those strains very closely. Our lab director, Dr. Christopher Ball, some of you may have heard him on various presentations that he gives and talks about this, but he's working with private labs around the state to watch for these variant strains. If they see anything suspicious, they're being immediately sent off to either CDC or to an academic lab that we work with to see if it is one of these new strains. And eventually, Dr. Ball is hoping by the end of February, our lab will be able to also monitor and do all the sequencing for these strains. So they're working on getting that set up. So those are the points I wanted to make before we open it up for questions. And I don't know if Nikki ever joined us, or Director, are we on our own here with
Nikki is on. I think she slipped into Elke's office when Elke left.
Oh, there she is.
Yes, I did. I'm wearing a mask out of an abundance of caution, but apologies for all the computer issues we had. I think my computer decided it needed a break today or something. So we will now take vaccine-related questions from our media participants. We're going to answer as many questions as possible in the time we have today. Please raise your hand in WebEx by selecting the hand icon to the right of your name in the participant list. You can also type your question into the chat area, which you can access in the lower right part of your screen. So when I say your name, please unmute yourself and announce your name and media outlet before asking your question. And I see I've already got several hands here. We'll start with Melissa Davlin.
Thanks, Nikki. This is Melissa Davlin with Idaho Public Television. Along the lines of what Dr. Hahn was saying about health equity, I was just looking at a report that showed that data from 14 states showed that vaccine coverage is more than twice as high among white people on average as it is among Black and the Hispanic population. And so, two-part question: is Idaho tracking this racial data at all when it comes to vaccine distribution? And can either the director or Dr. Hahn talk a little bit about what is being done as far as outreach with Idaho's Latino population, as well as the refugee populations and tribal communities and other historically disadvantaged communities?
Yeah, thank you, Melissa. Yeah, as I mentioned, it is really important to us. I think you've heard Sarah Leeds say, unfortunately, our registry, we are limited in what we can collect. It is outlined in statute. So that would be the best way. You know, if our immunization registry had right in there, let's say the race and ethnicity of every vaccinee, we don't have that right now. We are working very hard to make sure we are including those communities in our discussions. I think I've mentioned that we have folks on our advisory committee, but Sarah Leeds is on this call, I believe, and she might have some more specifics about some of the activities the immunization program is doing just to try to monitor that work. I will mention regarding the refugee community, because Sarah won't necessarily have an answer to that. We do have a refugee health screening program. And I recently had questions maybe 2 weeks ago from the refugee community about how we could work better with them. And I did refer them to our health screening program. Haven't heard anything back yet, but you raise a really good point. I'm going to reach back and kind of make sure I'm a little more familiar with what's going on in that community. We do have a very good relationship with the refugee health providers because of our health screening program. And I'm going to reach back through to them and make sure that we're doing well in that community. Sarah, are you on, and do you have anything to add?
I am, yeah, and I just want to emphasize that, Dr. Hahn is correct. Idaho's immunization information system is limited by statute in the mandatory information that we are allowed to collect. And so our ability to provide that information on a consistent basis across all vaccinations is not as robust as we would like. So the things that we are doing at the immunization program to help ensure equity are, of course, as Dr. Hahn mentioned, we have representation from various community members or underserved community members and organizations on the CVAC, on the COVID-19 Vaccine Advisory Committee. And then at the program level, we meet weekly with various tribes through our public health preparedness and response have a weekly meeting that we also attend and can communicate with them sometime, or on a weekly basis. And then we hold a meeting. There's 2 meetings on Fridays that we can interact with our tribes with. And one is hosted by the Northwest Portland Area Indian Health Board. And that is really a more focused vehicle for us to work with tribes. And so, those are just some of the things that we're doing to work and ensure equity of vaccine distribution.
Thank you.
Okay, thank you. I think we'll go right to the next person who had their hand up in line, and that is Audrey Dutton.
Good afternoon. This is Audrey Dutton from the Idaho Statesman. My question concerns the federal pharmacy program, and I'm wondering how much information the state is able to gather about that. I'm wondering, last week I think it was, I saw a slide in one of the presentations that showed that only about half of the long-term care facilities that had signed up for the program had gotten their first visit. And I'm wondering if we know how many doses have been distributed to CVS and Walgreens, and how many have been administered.
Yeah, Sarah, do you want to say what you know about that, and I'll add anything if there's anything else I know that you don't know.
Sure. sounds like a good partnership. We know that every dose, which is 33,150 of those primary doses that were supposed to come from Idaho's allocation and be transferred over to the Pharmacy Partnership for Long-Term Care, those have been transferred over. And the last data I saw was clinic schedules. And so the clinic schedules had been, of both Walgreens and CVS, were through, I want to say it was February 2nd, but they should have all first doses and those clinics scheduled by February, the first couple days in February.
Yeah.
Okay,
go ahead.
Go ahead.
Oh yeah, Audrey, I was just going to add to that and just acknowledge that we would like to know a little more, and we have a long-term care strike team that just works with long-term care. We work Division of Public Health, Division of Licensing and Certification, and also other members, including Medicaid and so forth, work together just to focus on COVID in long-term care. And they actually just announced, for a lot of discussion about this last week, they're pulling together a group, kind of across, folks from the licensing and certification, public health, and others, to try to really get a better feel for what the uptake is in those long-term care, because we know that they can go and have a clinic visit, but not everybody's going to accept the vaccine. You've probably seen the national stories that some long-term care workers are turning this down. So we're going to try to do a little intel gathering and get a little more information on exactly how many we can see through the federal data system, how many residents were vaccinated per out of their population, but we don't know of the workers what percent of uptake there is. So we need to get better information on that, and we are working on that. Again, folks have 2 chances because the Walgreens and CVS are going 3 total visits. So they'll do first dose, then they go back and they'll do second doses, but they can do first doses of people who declined or weren't around that first time, and then they're going to go a third time and finish up those folks. So this is all ongoing and in process, but we are working to get better information on that.
Okay, thank you. Yeah, one of the reasons I ask is that I get questions all the time, I'm sure everyone does, about why do we have X number, but we've only administered X number, and just trying to figure out what the reasons are for that. And I wondered if maybe it's that, CVS and Walgreens haven't been able to roll out as quickly.
Yeah, that's certainly true. As Sarah alluded to, you heard some of the some of those doses, they haven't even done the first doses yet. So there's definitely some delay there. Most states, I think all states but West Virginia went with the federal partnership. Am I wrong about that, Sarah? I think all states but West Virginia did the federal partnership. But West Virginia just went out and did it themselves. And we thought that having the help of the Walgreens and CVS would make things faster, but it hasn't worked out that way. I don't think we could have predicted that. I think that they're doing the best they can, but it's not the speediest, as speedy as we had hoped.
Okay. Looks like Clark Corbin has his hand up. We'll go to Clark next.
Thanks for unmuting me. This is Clark Corbin with Idaho Education News, and I just wanted to thank everybody for doing these regular press briefings. I understand what Dr. Hahn and everyone said about the limited data that we're collecting about the people who are immunized. But as we prepare to move on to a large class of 65 and older, my question is, what do we know about how we're doing with vaccinating our teachers? You know, particularly teachers in the small rural school districts that make up the heart of our state. Thank you.
Yeah, Sarah or director, do you have any? I certainly know personally a lot of teachers who are telling me they're getting vaccinated, but I don't have a good, like from the school perspective, what % of the teachers are getting vaccinated, that type of thing. I don't know, Sarah or director, if you've heard any of that.
Yeah, unfortunately, occupation is not something that we collect over IRIS. And so again, it's unfortunate in times like these that the statute limits us so that we can know these answers. But I've gotten, I mean, same as Dr. Hahn, anecdotal. I've heard from a lot of teachers and preschool teachers that have gotten vaccinated, but we don't have hardcore numbers about occupation.
Okay. We'll move on to Morgan Trow, who's got his hand up or her hand up. Morgan.
Hi, I'm Morgan Trow with CREM 2 News. I want to talk a little bit about equity and accessibility. Are you or will you be addressing those who don't have access to Wi-Fi, who can't access a computer, or who maybe don't have cell service, so they can't find out this information? How are those people going to have access to the vaccine?
Yeah, thank you for that. I know we've talked about it a lot. And again, Sarah, I'll let you start and I will chime in if there's more.
Sure. So we have a pretty robust communications team working with using a lot of strategies for getting out the word for, I guess what I'm going to call hard to reach populations, and working with community groups and sort of maybe non-traditional communication methods. So trying to get the word out through churches and faith-based organizations. And so they have a really multi-pronged strategy. Of course, we are relying heavily on technology, but we do know and are working to ensure that there are ways that hard to reach populations understand where they can get their vaccination and how to sign up and how to get an appointment.
Yeah, does your communication team also have a protocol in place for the 65 plus who are going to be eligible to sign up? Is there a plan that you have to help people and sort of guide them through this process, or is that more divvied up by county?
I think I might not be the best person to answer that question. Dr. Hahn, can you take that one?
I thought the director was going to mention this opening comments, but now I'm not sure if he did. Director, chime in if you have, but we do have our website that's going to go live February 1st. That is going to hope, and I hear you, understand that not everybody's going to be able to access that website, but if people can get to, it's really directing them to the local public health districts. And that's what we're trying to get the message out to folks, because we understand not everybody is able to go online and sign up online. And the health districts have all provided information to us that we're going to share of how to best reach them, whether it's a phone call, whether it's leaving their name somewhere, or whether they can do an online application. And director, I don't know if you have more to add about that, but it's really going to be the local public health districts working to make sure that people can sign up.
Yeah, and we plan to use, as Sarah mentioned a minute ago, kind of existing support mechanisms for this population, for each population as we go through, but specifically here for the 65 and older population. That population tends to have a physician, and so we'll work pretty heavily through their physician or their PA or their whoever their provider is to do any outreach that's needed there. For those that are remote or technology challenged, often they have some support system that's either through a state sponsor system or simply through family. And so, as Sarah mentioned, we're targeting those non-traditional communication channels to make sure that the word can get to those individuals that may be a member of a church that the faith-based community is keeping an eye on, that can make sure they know what they need to do to help them get set up and get into the right place to get help. And then finally, the public health districts do this all day. They reach out to individuals that have health access issues or challenges for whatever reasons, and have multiple tools at their disposal to reach these populations for many issues. And certainly we'll use that in this case for vaccination. So we're going to use the existing tools that are out there and try some non-traditional ones as well.
Great, thank you. I appreciate it.
Hey, Nikki, I do see a couple questions in chat. I don't know if you can see it because you're at Elke, not at your own computer. So I just wanted to mention them.
Yes, thank you. I know I have seen those. I think what I'm going to do is we'll take this last question from Rebecca Boone, who's got a hand up here, and then we'll shift down to the chat. I think Melissa Davlin still has her hand up, but that may be a holdover from her first question. So with that, we'll go with Becky.
Hi, I'm Rebecca Boone with the Associated Press here in Boise. A couple of questions. I understand that you don't know this for the group of long-term care workers that were vaccinated through the pharmacy program, but do we have any numbers or estimates of the people in each priority group outside of that pharmacy program who have passed on the opportunity, who are eligible but have declined the vaccine? And then secondarily, do we have any numbers of people who actively want the vaccine in each priority group, but are still waiting for doses as we enter the next priority group?
Yeah, I could start with that, and I'm sure Sarah will have more information. I will say we've asked the hospitals in particular, because as large employers, we know they're vaccinating their own staff, so they have access to that kind of information. You know, unlike other employers that might not know because their employees might go over to an urgent care or to a pharmacy, they might not even have that information themselves. But the hospitals are telling us, and again, they're still in process, so nobody wants to call it final, but they're seeing between 60 and 70% anecdotally of their staff accepting the vaccine and wanting the vaccine. Of course, we had hoped for more than that, but that's a good number. And again, because so far it has mostly still, as far as numbers wise, been healthcare workers. That's where we have the best data. We're going to circle back to them when they've had a little more time to try to get more final numbers on that. I think some folks will be, we've all heard this, people just saying, I'm not declining the vaccine, but I'm going to give it a little time and see what happens to everybody else. So I think we do have some people who are just waiting a little bit, and I think those numbers are going to continue to improve. As far as the overall percent of the population that has gotten vaccinated, after healthcare workers, where we'll have some way of looking at that, it's going to be very hard to know, because for the reasons we've already talked about, and as Sarah mentioned, our immunization registry at the state level doesn't track what group somebody's in. Unless it's an age-based group, we'll be able to look at that, but we won't be able to track like first responders versus other groups, that type of thing. Sarah, did I miss anything, or director that?
You got it from my perspective.
Same for mine, Dr. Hahn.
Okay, we'll move on to a couple of questions in the chat. We have one from Karen Bosick, who writes for Eye on Sun Valley, and she asks, have we ever been able to determine why Idaho was among a few states that was shorted vaccines per capita? And if so, is there any hope of getting those back?
Director, I know you have some.
Yeah, I'll take that one. So yes, if you go to the CDC website, you can look and see a bunch of information, but one of those is how many doses have been distributed per capita. And our understanding is that those doses are supposed to be distributed on an equal per capita basis. That is not what's been happening. And in fact, actually, there's only one other state that's lower than us on doses distributed from the federal government per capita. And we have actually this week reached out to the new administration to ask that question, to officially lodge our concern as to why Idaho is receiving less per capita than other states, and ask them to remedy that situation. The response that we've had from them was is they're still getting settled in, if you will, and that they would get back to us shortly with an update on what the actions might be there. But we do not have a good understanding. In fact, we have no understanding of why that's happening, and are very concerned about it, and have been reaching out to our federal partners to raise that issue and ask them to address it.
Okay, thank you, Director Jepson. We have another question here from Misty Inglet with KPVI in Pocatello. And her question is, with so many 65 plus and limited doses, will it be first come, first serve for that age group? Or will there be ways to subclassify that group further of who gets the vaccine first?
Yeah, I can provide some answer, and Sarah and Director might want to chime in because we are all struggling with this a little bit. We did go to our advisory committee, and one of their options to consider was 75, starting with 75 and above, because that is initially what the CDC was recommending we move to. So we proposed that, but also proposed other considerations for them. They opted for 65 and above, so we felt like we've been told that it is that we are to open for all age groups and with the governor's agreement. So that's the plan. However, I do know that some providers have, some of our larger providers have reached out, looking into their own patient mixes, and are reaching out to more senior, like 85 and above or 80 and above, and are trying to make sure that they get slots, because kind of to the point earlier about equity, those, I'll call them the more seniors are even less likely to be able to quickly get into an internet, online registry or that type of thing. So we really appreciate the providers that are making that effort. But officially, a 65-year-old, if they can get an appointment, is not being held back from that. Director or Sarah, do you have more to add about that, or more you've heard from providers on how they're trying to manage that?
No, that's.
Oh, go ahead, Sarah.
Go ahead. No, go ahead. I was just going to confirm that's pretty much the information I have.
Yeah, that's the same information I have. I don't have anything to add to that, Dr. Hahn.
Great. I need to learn not to call on both of you guys at the same time. Sorry about that.
All right. Thank you, Dr. Hahn. Next, we'll go back to Audrey Dutton, who has her hand up again.
Hello. My question kind of builds on the last one. So a lot of the pandemic has been about public perception and about people feeling like they're being treated fairly, they're being passed over, or they're not important enough for something. And I'm wondering what you're expecting from folks when we have a group of 500,000 people right now, and then on February 1st, kind of becoming eligible for still only 21,000 doses a week. What are you doing to make sure that people don't get too frustrated and angry and that sort of thing, and trust that the rollout has their best interests at heart?
Yeah, thank you, Audrey. You definitely, come to one of our biggest challenges right now. I think one thing that was helpful for me, we have recently done a survey of the vaccinators out there to our providers to say, hey, how much could you do? How many folks do you think you could be vaccinating right now? And as we've done those surveys, one thing we heard from some providers is that they're struggling to, they vaccinate everybody in the priority group that's within their, in their community or in their reach, and they don't know where to go next. So we want to make sure that we have it open as wide as possible to make sure that vaccine is getting used everywhere, and yet without the perception of having it so wide open that people get trampled over on the rush to the door, so to speak. Really, and the director might want to speak more to this, but really our Office of Communications is very aware of this competing concern of making sure people feel like it's fair and equitable but also that they're not getting just pushed down, that they're not going to never get it kind of thing. And that's a very, very difficult message. The director mentioned and Elke mentioned the message that we are trying to repeat, that yes, the eligibility starts February 1, but we know it's going to be, I mean, if we're getting 20,000 per week-ish, and we know there's over 200,000 people in a group, it isn't very hard to calculate that's 10 weeks. We're hoping it'll be less than that if we get this new vaccine approved. That's why we don't like to use solid numbers. We don't want people to get discouraged. It may be better than that, but it's a difficult message. Director, do you have anything to add to that from a communication standpoint?
Yeah, part of our communication strategy is things like this press briefing, and to rely on the media to help us to say, we're opening up for 269,000 people here, but we know we only have vaccine for 21,000 a week. That's our supply coming in, which does mean it's going to take a few weeks to get through that, actually multiple weeks to get through that. And so, we continue to try to make sure people are aware of that, to ask for their patients. I would emphasize again that anyone who's 65 and older who wants the vaccine is going to be able to do so. And then we'll have to work through that appointment process. The vaccine is the best way to administer the vaccine is through an appointment process with the providers in their areas, and to just have to ask for their patients, but also to let them know that they will get vaccinated, that this will happen. But it's just not going to all happen in the first week or even the first month. It's going to be spread out over multiple weeks here as we go through the process. As Dr. Hahn said, we really hope that we get an additional vaccine supply from a new manufacturer here. And but in the meantime, that's really about making sure we get the message out that says you're eligible, but it's going to be a little while. And please exercise some patience as we move through that process.
Can I ask just one really quick clarification question? Is the 20,950 a week, is that just the initial dose, and the second dose is waiting in the wings and doesn't show up in that number? Or does it include both?
Yes, that's correct. I'll let Sarah chime in here because it's a tough message. But yes, those are new doses for starting vaccination series. And in a lot of our information we have available, you can see that a little more clearly. But Sarah, do you want to comment on that?
Yeah, no, I always want to emphasize that when we announce these numbers, we're always announcing what I think of as the new vaccine that's available. And there are always, every time we get those, like this week, we have arriving in Idaho 20,975 doses, and that either 2.5 weeks later, 3.5 weeks later, those partner doses, depending on if it's Pfizer or Moderna, are coming in and will be able to be administered to all those folks who got this week's dose. So whenever we talk about these numbers, we're talking about the ability to vaccinate new people.
But the total doses that we see on the dashboard, those are going to be including the booster shots and the federal partnership ones.
Yes,
correct.
And there's a delineation there as well.
Okay, thank you.
You're welcome.
Okay, our next question we'll take from Troy Oppie. Here, Troy, I'll go ahead and unmute you.
Thank you. This is Troy Oppie with Boise State Public Radio. Dr. Hahn, you mentioned earlier that you do want to see all those doses used, and sometimes at the end of the day, that comes down to vaccinating somebody who's not necessarily in one of these priority groups. As vaccine distribution reaches smaller places with more and more providers, what is the guidance to these places to avoid situations of a free-for-all? Of providers doing, vaccinating friends, or in the worst cases, taking kickback under the table. What guidance has been issued so far?
Yeah, Troy, that's a great question. We're obviously very concerned about that. Again, we talked about the importance of maintaining the public trust, and stories of so-and-so's, neighbor getting it because they're friends with the local clinic. We knew that would not be good for the vaccination effort. It's not fair, and it makes all of us angry to hear those kind of stories. And so we wanted very much to avoid that. So early on in this, actually, Sarah wrote a very nice guidance. We heard about a possible scenario where, and I think the provider wasn't trying to do anything wrong. They just thought, oh, I've got some extra doses. I'll reach out this way. And So Sarah wrote a really nice letter out to our providers, reminding them that their number, that the priority was to stay in our group, but that we also didn't want to waste vaccine. And so kind of trying to, and then to call the public health district if they really felt like they were stuck. They had 10 doses left, and it was either going to be pulling people randomly off the street or throwing them away, that they could use the public health district to help them find a better space. Sarah, do you want to go into more on that, or?
I think that's really adequate. I mean, we are relying on providers to share our guiding principles of equity and maintaining that balance of using vaccine and not wasting any doses, but also equity of distribution and getting it to the folks who have been prioritized. And I think for the most part, they are doing that. Very occasionally there will be a situation where there's maybe 2 doses left in a vial, and we, I think we have to trust that they've done their best to administer as appropriately as possible, and then also, it's our job to kind of keep a watch out for those folks who may not be doing it, and we would take action if we heard that for sure.
Okay.
Is it safe to characterize that as the honor system?
Yeah, Troy, I'll say I think it's a bit of a combo. Like Sarah said, we certainly have received some concerns, and we do look into those, and we do want providers to know that we're paying attention. Like Sarah said, they've been few and far between, and often just due to misunderstandings more than intentional wrongdoing. But we are watching that, and I think it's important to keep the faith for people to know that we are. But yes, of course, we can't monitor every dose, and there is a large part of this, the honor system. These are all healthcare providers. I think for the most part, they want to do the right thing, and we've heard very few stories of possible, folks getting it that maybe weren't the best choice.
Thank you both.
Okay, we have 2 more reporters with their hands up. We'll try to get through these as quickly as possible. I've been asked by the director, he's got another commitment that we're going to have to wrap this up at 3:35. Again, I apologize for those technical issues at the beginning that we used up some of our time. Our next question will come from Clark Corbin.
Hi, thanks again. Clark Corbin from Idaho Education News. When we do move on to the 65+ population on Monday, if there is a teacher or perhaps a frontline first responder who was not able to get vaccinated to this point, would they still be able to get their vaccine in a week or 2 if they haven't got it yet? Or once we move on, have we truly moved on to the 65+? Thank you.
Yeah, they're absolutely still eligible. Once you're eligible, you're always eligible. We would encourage, though, those teachers to, maybe call this week before the flood hits next week. I think we'll have a lot increased demand. So I would encourage those that have been waiting to, call now or try to get on a list now while you're, a little bit still in a smaller group.
Okay, our next question will be from Rebecca Boone.
Hi, thanks again. Real quick, what percentage of adult Idaho residents need to be fully vaccinated before kids who are too young to get the vaccine will have some sort of protection?
Oh, that's a great question. I don't think that's known yet. You probably are aware, we haven't talked about kids much yet, but you probably are aware that there are clinical trials in children right now of the vaccine. I read some really great news stories in the last few days about some of the clinical trials, even including here in Idaho in children. So I don't think we're going to wait for kids to be protected by the adults being protected. I think that the recommendation eventually will come out for at least some children, whether it's adolescents or whether, what the age range is going to be. I can't guess yet. But there is an advisory committee meeting of immunization practices tomorrow. That I will be on that call, that meeting at CDC's meeting, and they're going to talk about children. So I think we'll learn a lot more tomorrow to kind of see which way things seem to be heading for kids.
Thank you.
Mm-hmm.
Okay, I don't see any more questions from the media panelists. So with that, we'll wrap it up for today. We are planning another media briefing about the vaccine in Idaho at 2:30 p.m. Mountain Time, Tuesday, February 2nd. We'll be issuing those details on Monday. Thank you for joining us today. Are you muted?